Hello class. First of all, I want to welcome you to Nursing 100 and also want to welcome you to our ADN nursing program here at Lorain County Community College. As some of you recall from boot camp, since we don't have class on Monday due to the Martin Luther King holiday, I just wanted to kind of talk a little bit about what we would have discussed in class and to go over some of the most important things that you need to understand in order to progress through this concept-based curriculum. As you can see on the screen, I brought up one of the activity sheets that is at the end of your syllabus, and I really want you to look at these ADN concepts. These are the ones that we as faculty, when we were developing our concept-based curriculum, chose these concepts to provide the learning and the application of what you need to know as a nurse to provide safe and stellar care to the patients that you're going to be caring for. And in this course of Nursing 100, we are going to discuss most of these concepts and only the concepts. And as you can see on this sheet, we will talk about elimination, oxygenation, mobility, stress and coping, perfusion, nutrition, leadership, sensory perception, communication, comfort, metabolism, healthcare delivery, and tissue integrity. Those are the concepts that we will cover here in Nursing 100. And as you probably have noticed, the definitions of all the concepts are given to you within the syllabus itself. So I really want you to take the time to look at these concepts and look at the definitions that we have provided for you so that you will get a feel of exactly what we're going to talk about in regards to these concepts. This type of learning is a whole different type of learning than you're used to. I kind of touched on this very superficially in the boot camp, but really how we present you the information to learn and how to be a nurse and to understand what's going on with your patients will all be provided to you by the delivery of these concepts that I've just talked about. And as I said, we will just discuss mostly the concepts here in Nursing 100. And Nursing 100 course is basically a physical assessment course, because this is where you will begin to make those all-important assessments to determine at what state of health your patients are in, okay? And along with these ADN concepts, we have on the right-hand side what we call our LCC Nursing Program Core Organizers for the curriculum. And these are very important too because they kind of intertwine with the concepts. And as you can see, we have 7 of them, and each one is so important, and it really does guide our professional practice as well as providing learning and resources that are related to these particular core organizers. And the first one you see here is patient-centered care. And this is kind of a new thought process of how we deliver health care to our patients. Back when I first got out of nursing school, it was about what we wanted as healthcare people for our patients. And our patients really never had a real sense or a real say-so in what should be done for the care that they receive. But now we've kind of switched gears, and we've decided that in order to provide the best care, that care should be definitely centered around the patient. They are in charge of their care. We just provide all the necessary information, resources, test results, and then it is up to the patient and their families to make that final decision about what they want done. Obviously, many of them really respect and go by what their healthcare provider or their doctor recommends. But basically it is really up to the patient to be totally in charge of what happens to them in the care of what is definitely ailing them. The next one is teamwork and collaboration, and this is very, very important, because now as we see patients who are admitted in the acute healthcare system, such as your hospitals, the patients are very sick. They have high acuities, and what high acuity means is they're very sick. A lot of them have multiple problems. Your patient isn't just coming in with only one diagnoses. Many times these patients may come in with some type of maybe respiratory problem. They come in because they develop pneumonia, but then this patient may also have chronic diseases, maybe anemia, maybe heart disease, maybe heart failure, maybe they've had a history of cancer, they've had radiation or chemotherapy. So because of that high acuity of that patient, it's very difficult for the nurse alone to provide the best care for that patient. So we as nurses collaborate, or we kind of work with other healthcare members to deliver the best care. If our patients have pneumonia, maybe they need some type of services by the respiratory therapist. Upon discharge, your patient may need some advice or some appointments set up by the case manager, dietary, the dietitian, even the healthcare provider or physician himself. We all work together as a team to bring our levels of expertise into the situation so that we can give our patients the best care. So that's what we mean by teamwork and collaboration. The nurse alone now cannot do it by herself because of the high acuity of our patients. The next one is evidence-based practice, and evidence-based practice is huge, because evidence-based practice is all the research that is being done on certain treatments or guidelines of best practices for certain situations that occur with our patients. And I will tell you that as a nurse for over 40 years, I have seen things changed very drastically over the last 40 years. Things that I used to do when I first got out of nursing school, we do not do anymore for our patients, because through research and best practices, we have learned that that's not the best approach for our patients. So that's what definitely guides our practice as professional nurses, is evidence-based practice. And we also thread these core organizers within our curriculum or our courses, and an example of that would be you will be doing some type of evidence-based practice written work, and this will be more explained in week 4 in your lab when you make a visit to the library, and Mrs. Sheets, the librarian, will discuss how you research databases to find peer-reviewed and very reputable and reliable research practices that will tell you exactly what's the best way to do a certain thing for our patients. Maybe you're very interested in someone that has an IV, so we do research to determine how often should we change a patient's IV to minimize the chances of infection or problems associated with an IV. Maybe you might want to look about how we care for a patient with a Foley catheter. So you might want to look and find all the research out there about how long should a Foley catheter be left in a patient, or is there any certain procedures we should follow to minimize infection and complications from a Foley catheter. So I think you kind of get the gist of what I'm saying here, is how important evidence-based practice is, and you will learn how to access those particular research articles and databases. So we'll talk more about that at a future date, but as you can see, that does represent how we as faculty provide you how to understand that particular core competency by providing you an assignment associated with evidence-based practice. Another one is quality improvement. through evidence-based practice, we look at quality improvement and look at statistics and say, hey, we noticed that because we gave an in-service on the importance of hand washing, we have noticed that on the 1 unit, infections are down 10% this year or something like that, because we have looked at things that will definitely improve the quality of care. Another big one is safety, which is absolutely huge. Safety of our patients is of the utmost importance, and this is probably one of the #1 things. Just by identifying your patient, you are keeping your patient safe, because you're making sure that what medications or procedures need to be done for a particular patient are being done on the correct patient. So when you go into that patient's room and properly identify that patient with give me your name and give me your birth date, you are instituting and implementing safety precautions to keep that patient safe. Informatics are what we use now for documentation. A few years ago, we have gone to electronic medical records, informatics, which has proven to be very beneficial for our patients. It's a way that we can communicate throughout the whole healthcare team, and even through the whole networking in a certain hospital, for instance, the Cleveland Clinic through University Hospital. Informatics has proven to be very important. Years ago, when I first got out of nursing school, we did paper charting. That is pretty much a way of the past. It's all in a computer where the information is there available, and then again stored on particular databases or whatever. The last one is professional identity. We as nurses are really examples of professional identity, and we as nurses exhibit that professional identity every day we come to work and care for our patients, because we are a profession by itself. Think about us as a professional nurse. We are the ones that are with that patient almost 95% of the time. So we are kind of that central character that really is in charge of the care of that patient and have a huge responsibility to deliver the best care to that patient. So I always tell people as nurses to deliver the care to your patients as if they were your family. And if you can leave your day's work and say to yourself, that patient got the best of me, the best care I could possibly give. I thought of them as my own family. If that was my family, I feel like I gave them the best of what I could give them on that particular day. So I hope that makes sense, that I talked to you about the concepts along with the core organizers. And if we had been in class, we would have done this activity where we select 2 of the following ADN concepts and relate each concept of all the IOM core competencies. And we can look at how those core competencies can really help you better learn the ADN concepts. And let me provide you a particular example. We look at patient-centered care. How would we be able to see how that related to some of the concepts? We could look at healthcare delivery, because now our healthcare delivery is based on patient-centered care. We could look at leadership, that as the nurse exemplifying a characteristic of leadership, she takes charge of patient care and really does make that patient at the center of the care that she delivers. You could use teamwork and collaboration, definitely with communication, because as a member of the healthcare team, we as nurses do communicate what's going on with the patient, and they in turn communicate back to us maybe a particular intervention or treatment that they provided for that patient that they would want us to know whether or not the patient did well, tolerated well, or the patient became better, or maybe had some complications due to whatever intervention was given to them. Quality improvement may improve the comfort and care of what we provide for our patients. It could also be involved in healthcare delivery and things like that, and definitely economics, because let's face it, when we have patients in the acute care setting in hospitals, hospitals are now a business. So really there is an economic side to it about how do we provide the best care, but we provide it more in an economical way. Informatics, again, can be through communication. It might provide, you know, less stress and to fellow healthcare members because of the fact that the communication process is much better and that all the information is there, and it will also hopefully improve the safety of our patients too, and prevent things like med errors and things like that, and that we're not seeing a lot of redundancy with care, that one healthcare team member provides this and another provides this specific kind of care. And then of course professional identity really is about healthcare delivery, leadership, economics, cognition. There's so many of that kind of overlap in regards to professional identity. So that's kind of what we would have done had we been in class, to kind of see how these IOM core competencies can really help you understand exactly the importance of these ADN concepts. All right, let's just continue with a few of the other activities that we would have normally done had we had class on this given day. We're going to talk about healthcare delivery. We'll kind of introduce you to healthcare delivery. This paragraph is about nurses' understanding of health and wellness largely determines the scope and nature of nursing practice. Clients' health beliefs also influence health practices. Currently, healthcare providers are increasing their emphasis on promoting health and wellness in individuals, families, and communities. Today's nurses must be able to work with diverse populations of clients and examine their own values and beliefs. The healthcare systems relate to methods of delivery and management, including financing and coordination of services. Nurses can provide high-quality care by participating in quality improvement and quality management. And as you can see, it's very important that you look at what are the student learning outcomes. So what that means is they're kind of called SLOs, and that should tell you that after that particular activity or after reading that particular assignment that you get from that weekly schedule that's in your syllabus, you should be able to explain concepts of cultural diversity, describe influences that affect cultural competent health care, discuss examples of diversity in health and illness care, and relate the role of the nurse to culturally competent health care. And you will notice too that theme will continue in our lab this week, as well as then taking that information and then applying it in the clinical situation, which you will do when you experience your first clinical day on Tuesday or next week, whenever your assigned clinical day is. So with that said, we can kind of look and think about what are the different types of healthcare settings that nurses practice, because I think, you know, as student nurses, we think right away, oh, we're going to go through nursing school and then we're going to graduate and then I'm going to get a job in the hospital. And probably, if not most, but all of you will do that. But that is not the only place that we as nurses can provide healthcare services to our patients. There's other places. There's the home. Sometimes nurses like to be home healthcare nurses. So as patients are discharged, because many times these patients do not stay very long in the hospital. So we as nurses may have to go to the home and maybe give them medications. Maybe they still have a presence of an infection, and maybe they have to continue to have antibiotics or other certain medications or services that require those to be continued even after they're discharged. So the home is a place. Of course, the hospital, which is a quite obvious place. Sometimes at healthcare, at health fairs, community fairs that might be set up at a church or maybe a what am I trying to say? A gym or a healthcare provider services. Maybe nurses set up, tables that may monitor blood pressures, blood sugars. Maybe they'll check cholesterol levels. Maybe they'll screen patients for high risk for heart disease. So these kinds of things that you may see nurses also do. Nurses are very influential in a doctor's office. Long-term care, and even assisted living. And there's probably many more that we see nurses provide health care to our patients. I've known some of our students who have graduated and who are nurses in prisons. That is another very different kind of area to work in, but let's face it, prisoners get sick and nurses have to be there to respond and provide proper treatment. What other? Public health nurses, those are another type of services. A lot of nurses have become nurse practitioners and work as NPs at some of the pharmacies, the familiar pharmacies that you may even go to, CVS, Walgreens, and they definitely see patients through scheduling appointments, give vaccinations, treat sore throats, some of those things that are fairly serious but not serious enough where the patients have to see a doctor. So that's another way that nurses can provide excellent care to the patients, and not necessarily all the time in the hospital. There may be other ones that we can think of, but those are probably some of the main ones. So I just want you to kind of remember that we make a presence and we make a difference in other areas other than the hospital setting. The next question is identify some of the most important aspects of healthcare delivery from the definition above and apply to the different settings listed above. And we can think of things like diverse populations, and that's really important because, we just don't always see the average hospitalized patient. We see a lot of patients from different cultures, from different countries, that have different family lives, and we have had to adapt to that. How about illness versus wellness? Quality care. Are we delivering quality care out there to our patients because of the high acuity, the shortage of nurses out there, the demand on nurses out there? Are we providing the kind of care that we were able to provide when we were student nurses, and then we get out into the real world of nursing and we become very frustrated because we can't do the things that we used to do for our patients when we were student nurses. So these are things that are really of a big concern to nurses for nowadays, leaving work and being very frustrated that they just have not provided that kind of care to their patients that they used to. Values and beliefs. Do my values and beliefs kind of rub off on how I deliver care to my patients? Scope of practice. Am I practicing within my scope of practice? And we will definitely talk more about that in the future, because that's a huge aspect of how we how we are represented as a professional nurse. Healthcare systems, coordination of services, and of course the financial considerations. And that's a big one because, we've got people out there that still do not have insurance, and some of the concerns that our patients have, not only about their health, but definitely about their health, how they're going to pay for this. So those are some of the most important aspects of healthcare delivery from that definition that I read you that is in your syllabus. So I just kind of wanted to go over that with you. All right? And then as we proceed through this, we can look at, this thing, this spectrum or this continuum of health. when you have extreme good health on that left side, and then you have this continuum of illness to the right. And we can discuss the aspects of health and illness. Look at your book. What does the book say about definitions of health and what that means? And what does your book say about illness and the implications for the patients? And does being healthy mean that you cannot have an illness? And that's something I want you to think about. I'm not going to answer that question. So if you've got a person that has asthma, which could be a chronic problem, but can be very well treated with medications and a good understanding of the illness, so think about it. You've got a patient with asthma. Can a person with asthma never be considered healthy? Think about it. What about a person who is physically healthy but not mentally intact? So do we still call him ill? So I want you to think about those things, and we can maybe talk about this on Wednesday when we meet for the first time. Just something to think about. And I want to talk about promoting health across the lifespan. In your book, there's a table regarding recommended screenings and health promotions. Things that our patients should be aware of depending on what kind of things they should be doing at what particular age. That's in your book, and I'd like you to definitely take a look at that. And then there's a couple videos to look at, especially a child's eye view of hospitalization and exactly what that would be perceived as by a child. And that is in your Canvas course under week 1, okay? As you look at that table on page 440, you'll see that it starts really on page 439, starting with the newborn and infant, toddler, preschool, school age, adolescent, young adult, middle-aged adult, and older adults. I'm definitely not going to read all those to you, but I think it's really important that you look those over. And even ask yourself, depending on what age group you fall into, am I doing the best for myself in promoting good health? On page 442, review box 7.5. For you and your family, identify areas which could use additional support. Would you like to improve this primarily a biological dimension, a psychological dimension, or a cognitive dimension? Okay, so you might want to review that. And as you can see from that figure 7.5, it just talks about strategies to promote behavioral changes for each stage of change. And then as you can tell from some of your reading, your book really does talk about some of the health beliefs that your patients may even share with you. And some of these health beliefs may be true or not so true, but many of our patients do have that particular belief in regards to their health. And some of these are definitely influenced by culture, such as the belief that health and wellness are closely associated with the amount and quality of blood in the body. Now that might sound silly to you, but that is definitely what some of our cultural patients feel. For example, as your book talks about, in the American South, some individuals use the phrase high blood to mean they have too much blood in their body, causing headaches and dizziness. Another example is the racial ethnic disparity in flu vaccination rates for older adults. Groom, Zhang, Fisher, and Wortley found that the percentage of adults receiving such vaccinations mirrored their differing beliefs in its effectiveness. And health beliefs can also affect whether patients are likely to engage in health promotion or due or to follow a treatment plan. Social learning theory makes an effort to capture this likelihood through an explanation of locus of control. So, individuals who believe that they can affect their own health and wellness are said to have an internal locus of control. And these patients would more likely take control over their own health. Individuals who believe their health is controlled by forces outside their control, this is what we refer to as an external locus of health. So, very interesting types of things that you may hear from your patients in regards to their particular health beliefs, okay? So I just wanted to kind of point that out since that was on your activity sheet, and just kind of discuss that with you. Another thing I just wanted to look at and kind of get you to think about is what barriers exist to successful implementation of a change to improve your health. Is it your attitude? Is it motivation? Is it that internal versus external locus of control? Is it time? Is it resources? Or is it a cultural or religious objection? Or is it also a poor self-concept? These could be some of the barriers that affect why you do or do not maybe practice those screenings or recommended screenings that was on that particular chart. I know personally, sometimes with work and going to school, and you guys may find the same situation is, I don't always have a lot of time. It's very hard to schedule doctor's appointments and checkups and have my blood pressure checked or my lab work done when I've got to be here at class at 8 o'clock in the morning and teach all day. So these are barriers, but we really have to say, hey, how can I get around these barriers? And what can I do to promote good health and to practice good health behaviors? And think about the next question. What advice would you offer a patient who asks how to make a change to improve their health? Let me put this up on the screen. This was part of, here's the question down there. So that's a great question. What advice would you offer a patient who asks how to make a change to improve their health? And sometimes I think it's important that we not say it in a judgmental way, that we tell them we're people too and we don't always know the answers. But I think sometimes changes can start out small, but yet it could have a very, very big impact. Maybe it's just giving up one maybe not so healthy food instead of trying to totally change the way you eat. Maybe it's trying to walk at least once a week where you hadn't been walking at all, and then maybe start increasing that to twice a week and then get it up to 3 or 4 times a week. So sometimes it's the small changes that get us to kind of go down that path of healthier behaviors, and that's what I would tell people, because I think sometimes when we change too drastically, it's very hard to adapt to that really, really serious change. And then as we advance through this sheet, we can think about what is the difference between modifiable and non-modifiable barriers for health. And modifiable behaviors would be those external variables like diet, exercise, lifestyle choices, and non-modifiable are those internal variables like genetic factors, age, gender, developmental level. And think about the psychological aspect of it. Those are our emotional responses to stress, to distress. Those mind factors, and then our mindfulness. And cognitive are those spiritual and religious beliefs, coping skills, risk factors. So those are things that, you want to know those difference, because, obviously with non-modifiable, we really cannot change that biological, the genetic factors, our age or gender. And it's sometimes very hard to control those psychological responses. And, of course, cognitive. We have embedded in our hearts and our souls, our religious and our spiritual beliefs, so it's very hard to change those. But they do really influence our health, okay? And look at illness behaviors. What are illness behavior? It's a coping mechanism involving ways that individuals describe, monitor, and interpret their symptoms. They take remedial actions and use the healthcare system. And you might want to think about what are some variables you cannot change about yourself regarding your health. Obviously, we can't change our age. If we're 35, we're 35. We can't go back and be 25. And what variables you cannot change about yourself regarding your health, and what variables can you change. And we know that we can exercise more. We can try to respond less stressfully to situations. We can definitely, be the one responsible for relationships that cause us to, build up more stress in our bodies. We can eat better. We can get better night's sleep. We can smoke less. We can try to quit smoking. We can drink less. All these things that may affect our health. And you want to think about, too, as we continue to ask ourselves these questions, when you become ill, what are some of your typical behaviors? Do you manage them on your own, or do you seek medical attention? Things like that. If you're stressed, which definitely affects our mental health, do you go out and drink a lot to kind of drown your sorrows? Or do you take charge and maybe go out and exercise? Something that you may do would be a more positive way to deal with some of the stresses and difficulties that you're having in life. Okay? So, I think that's really, interesting when we talk about promoting health across the lifespan. And this definitely, begins, when a child is born, at birth. So, definitely wanted to, touch about that. Another thing I just want to kind of talk about before I conclude this audible lecture or discussion is, it's very hard to focus on our health when we have so many other stresses in our life. And, sometimes when, we're feeling okay, we really don't pay attention to our health like we should. And I do want to recommend that as students, nursing school can be very stressful, especially when you're trying to juggle all the other responsibilities that you may have. And so I just want to offer some piece of advice to take care of yourself, and just understand that with stress, you're more prone to becoming ill, especially in these winter months. And you really will do yourself a favor if you do take care of yourself. And I think when we look at the health across the lifespan, for instance, if we were nurses that were involved in some kind of a health fair, we might want to teach families, parents, about what kind of services or ways in which we can promote good health practices with that particular age group. For instance, with infants, it's always important to continue to take them for wellness checkups, to monitor their weights and their heights, plotting their growth and development, and really educating parents on what kind of responsible person would you have babysit your kids, because once in a while parents have to get out. They can't have their children with them at all times. But what really denotes somebody who's reliable and trustworthy with your children. And really, I think safety is another big issue with that age group in regards to feedings and in what positions these infants should be sleeping in, and of course immunizations. There's been some controversy with immunizations, but I think it's important that education be given to the parents to determine that they really are fairly safe nowadays, and that really their children do need those. If we go to the toddler age, again, very important that they're growing and developing normally, weights and heights. you know, these are the kids that will be preparing to go to kindergartens. Kindergarten, again, safety, immunizations, and of course, you know, animal and gun safety, because these are children that are in that age group where they're very inquisitive, and they are always touching, feeling, and getting involved with certain things. And you need to teach them about when it's appropriate to teach pet a dog or an animal, because we know that bites can be very dangerous for this age group. Think about the school-age child. Again, safety assessments. They're starting to ride their bikes, teaching them about helmets, proper car seating while they're driving in a car, seat belts, crosswalk safety. A lot of these kids, when they get to kindergarten, they go to what we call safety towns, so they learn a lot of these safety measures, that they should be doing. Developmental assessments, information on bullying, that's a big thing. We want children to know that they don't have to take that they need to talk to teachers and parents if they are being bullied. Developmental aspects of the child, immunizations, and this may be when children are screened for things like scoliosis. As children advance to the adolescent stage, they really need social and sexual education, pregnancy prevention, learning about the hazards of STDs, educational planning, and modeling behaviors for healthcare careers, and again, maybe some boosters for certain immunizations. With the young adult, health screenings for young adult, physical exams every 3 to 5 years, teaching women about self-breast exams and male about self-testicular exams. And again, in the adult populations, annual physical, flu shots, screenings for chronic diseases, and again, assessments of health history. And as one gets to be an older adult, glucose screening for possible diabetes, blood pressure screening, screening for possible chronic diseases, and if they have acquired those, how to manage them properly. Flu and pneumonia vaccines, and maintaining physical and cognitive abilities. And again, social health that involves the interactions from the support of community groups in their neighborhoods. So I just wanted to kind of go over that with you, and hopefully you've done your reading for this day. But this is pretty much the highlight of the information that you need to kind of go over to prepare you for that first quiz, because your quiz will be just over the information from week 1. I think that's all the information you need right now. This will get you off on the good foot, and continue reading and looking over things. Be prepared for lab next week. I think there's an article that you need to read. You're going to be looking at that cultural competency quiz and taking that. That is one of those assignments that you'll get a point for, and all students get it because your lab instructor will discuss this with you in lab and kind of go over the answers and the rationale behind them. But other than that, I think we're doing real good. And we'll discuss leadership when you come to class on Tuesday or Wednesday, whatever is your assigned day of classroom time. But for now, I think that's a great start. Give you a little bit of information on your reading, and if there's any questions, we can talk about that in class. But I hope you have a nice weekend and a good holiday, and be safe, and take care. We'll see you all next week.